it is emerging that the health workers' strike may soon come to an end. Sources in the Medical Practitioners Union have intimated that they are considering abandoning the strike. And as Wilson Mburu tells us now, this follows a meeting with several national and county government officials.
A senior official at the Kenya Medical Practitioners, Pharmacists and Dentists Union has told KTN that the nationwide health workers' strike could end any time now. They say they have met several officials from the office of the Deputy President as well as high-ranking members of some county governments and decided to end the suffering of Kenyans at public health facilities. This comes just a day after last evening's staff statement by President Uhuru Kenyatta, who called on the medics and the county governments to resolve the crisis immediately. Uhuru's statement, which appeared to close the window on any possibility of stopping devolution of health services, was followed by the return of several health workers to work. This is Longisa District Hospital in Bomet County, where 87% of the health workers are back to work.
We have 45 new recruits, and out of the 45, we have 5 medical doctors who are assisting us in management of these patients. There are also the doctors who are operating on patients who require surgical interventions.
In Mombasa County, the government was vigorously recruiting today after President Uhuru Kenyatta gave the green light to governors to do all it takes to save the situation.
And these are professionals, these are nurses, clinical officers, lab technicians, pharmacists, all the paramedics. We have employed so far 42 people in the different cadres which I've mentioned.
In Kirinyaga County, all the health workers previously on strike were expected back at work today after a deal with the county government.
We have given them the assurances and we have committed ourselves to do a small memo that the management can be able to use as a proof that the county government of Kirinyaga is going to do all what it takes to ensure that there will be no interference on, one, the salaries of the health workers in this county.
For 10 days now, services at public health centers have been grounded because of the strike in protest of devolution of health services to the counties. Tens of people, including 8 unborn babies at the Kenyatta National Hospital, died after the mothers failed to get the essential medical care. But even as that unfolds, a section of the health workers in Nakuru and Kericho counties are adamant that they will stay on strike until their demands are met.
Public health facilities are grounded and they shall remain grounded until such a time that we get our demand, which is very simple, that they reverse the illegal transfer of personnel emoluments back to central government until structures are put in place. Surely, is this too much to ask for?
Professional associations have joined President Uhuru Kenyatta in calling on the health workers to obey court orders.
We must respect that institution of the judiciary, because if it was an issue of only pursuing and listening to orders that favor you, then we would always be at cross purposes.
They were speaking in Nairobi County. Wilson Mburu, KTN Prime.